It can be also done at night for people who don't sleep well, insomnia, that's why it's called Yom Nidra also. There you see Adhyatmik Sadhana Kendra Swami Dharmananji still active, and the ashram is still open all the time. This is the only place in the world open 24/7 and doesn't stop even on a holiday and all. And this is the dedication of Swami Dharmananji that we have been able to do that well. And this is what is being taught. This is pranayam. Of course, this is sitting on the floor, but people could do it while sitting on the chair also. Those who could not sit on the floor, we said, sit on the chair. This can be easily done. Kayosar can be done by everybody. So 100% compliance of Shavasana, 100% compliance of pranayam. This is alternate nose breathing. I'll not go into details. And this is meditation. Again, people who could not sit on the floor, they were sitting on the chair, and they could do as well. And this has to be learned again. Very simple. I think one of so many methods of meditation. Sometimes people get confused. Should I do transcendental? Should I do vipassana? Should I do this thing? But this is one of the simplest methods, and it has wonderful results. It's scientifically proven and all. But you have to learn it from Shamli ji is here. You should take the advantage. Very easy to learn, and it has tremendous effects, not only on the health, but also on your keeping the mind strong and also your concentration. Very good for the children. They will perform better in the examination. See, we are always thinking of tuitions in India, but there's a lot of studies to show that if children are taught this, and it's not only their habits improve, but their performance in the examination improves. It improves concentration and so on and so forth. And this is, as I said, if you cannot sit on the floor, you can sit on the chair as this lady is doing and do this equally good. And this was the doctors and the nutritionists also told these patients why the disease occurs and how to reverse it. This was the first experiment combining science with spirituality. And these are our results. I'll not go into details of this, but with the Preksha meditation, you can see that the weight reduced on these patients. There were some people who were more than 100 kilos, they reduced as much as by 30%. So that dot means statistically significant as compared to control. And the angina, the pain which they used to get on walking also improved markedly. You can see that there was a 73% decrease here as compared to increase in the control group. So again, a randomized study, and even a treadmill test was done in all of them. Thallium test was done in majority, and you see they were able to perform better on the treadmill because we have to have objective data. And their cholesterol reduced markedly, 20% decrease in total cholesterol as compared to control. And this has been shown by other studies also, Dean Ornish, and there's a study from Brahm Kumaris also recently which shows exactly the same thing, that the cholesterol comes down, the bad cholesterol comes down, the LDL and triglycerides. And there is a regression. Angiography was done, and you can see there's a 20% of the people have shown regression, means more than 10% decrease in the blockages. It's not a complete clearance. So one should not get the impression that we can clear the arteries. It's not possible. Not a single case. I have done more than 1,000 angiograms, the largest ever, and not a single one has cleared the arteries. So please remember, arteries will never be cleaned. They can be cleaned if you start from the age of 15, 20 years when the disease is there. But they will not be cleaned, but at least they will not cause any problems. And regression is an important thing because small regression was able to reduce the Preksha meditation, was reduce angioplasty and bypass at least 8 folds as compared to control. So need for angioplasty or bypass was reduced, although the blockages were. These all have been published, you see. So this is, and these are the results. I'll not go into detail. They're statistically significant. Those of you are interested. The angina means the pain improved, their weight improved, their cholesterol improved, a treadmill test also showed improvement, and the angiography showed that there was a retardation of progression, a slight dip, and the need for angioplasty was reduced. In addition, these patients also had a lot of psychologically better. So, to conclude, regular practice of Preksha meditation can keep a person physically, mentally and spiritually healthy. It's an excellent stress management technique. I have not shown you in other diseases where it's useful. As I said, it has been shown in hypertension and psychoneurotic disease and so on and so forth. And extremely good stress management technique. We have seen in now 80,000 patients that if a patient of heart disease can improve, why not all of you? It can control several diseases, especially hypertension, heart disease and diabetes, and it should be practiced from early childhood. This is what I say. The question is asked, who should do Preksha meditation? Should it be done for the patients who have heart disease? The answer is no. I think it's already too late. But even if you do at that stage, the disease will stop progressing and may regress slightly. But the best time to do is from early childhood, because all these habits start from early childhood, and Shravani ji and Preksha meditation have a program for the children, and the science of living. I think that should be inculcated. Not only they develop good habits, they also develop moral values, and ultimately the diseases which start from early childhood can be prevented. Their performance, as I said, studies have been done, is better in the examination, and they become better people. There is a school, one of the very prestigious schools, the Heritage School in Delhi. It has 3 branches, one in Gurgaon, 2 in Delhi. There, Preksha meditation is compulsory, and there is a waiting list for admission there. You have to wait for 2-3 years, because the children there are completely different. Even the MNCs are sending their children there because they say children behave very well. Because they are taught good manners, and this is important. The children these days are very difficult to control. We are very poor in managing our children now. And I think Preksha meditation, somehow if you can coax them, you don't have to coax them too much. Just bring them with you, do the Preksha meditation, and it will have an effect. Actually, you can't force anybody, but if you start doing, we have seen in our families that we were treating, if one person starts doing Preksha meditation, others initially observe, they ridicule him initially, but slowly they join, and children also sometimes join them. So, even if you are alone, please start it, do not give it up, and others will, it will have a encompassing effect. So we have, because of so many advantages of Preksha meditation, there have been lots of hospitals which are now having